going from an undergraduate to graduate training, they could think about psychology. And generally, I tend to push people more, especially if they have an academic interest or research interest, into clinical psychology. But there's medicine, and I think there are some real advantages of being a physician rather than a psychologist in a variety of different ways. But other areas, certainly School of Public Health. We've had many students who go on to get their master's in public health and do very well, and sometimes a PhD in public health or in nutrition, exercise science. So it really depends on the student's interests, and but if they really want to be in psychology, then I try to push them more into the clinical realm than in a health psychology without the clinical training. I think it gives people more opportunities and a little bit more in-depth appreciation for some of the psychological, psychiatric issues that patients with medical conditions face.
But I took an intro psych class, and the professor said, if you're going to major in psychology, double major. So I said, maybe I will. So I majored in biology and remained a pre-med student all the way. And I also majored in psychology and debated for 5 years. Medical school, clinical psychology. The biological background helped me a ton because I took 9 courses in biology, so I'm pretty well was up on biology, physiology, anatomy, and a number of other things.
Well, first I would try to make sure that what they're really looking for is psychology, because of course there are a variety of other health professions that are wonderful, and some people are really more suited to those but haven't quite figured that out yet. So I talk to them about medicine and nursing and speech pathology and social work and so forth, wide variety of things, pharmacy. And if we do narrow it down to more of a psychology type focus, then I recommend that they get involved in a lab, doing research in a lab. And there are a lot of options for that. Just try to find a good fit for them there. And I give them some advice about the kinds of courses that they take and recommend that they try to develop a good research basis. They take their research methods courses. I do recommend becoming a psychology major, although I don't think that that's absolutely essential. I think it just makes it a little easier, especially if the graduate school they apply for requires the psychology advanced test.
Having a general interest in health and behavior is a wonderful platform for or a pathway to many, many fields, whether they want to become a health psychologist, a physician, a nurse, a public health specialist, any number of, a pharmacist, any number of the health professions will allow someone to address their interest in health and behavior. So part of it is getting some practicum experience or volunteer experience right as an undergraduate to see what might be the best fit, both in terms of professional setting, the scope of professional responsibilities, and who they identify with. And certainly in this day and age, what's most fitting of their educational needs at the time. Certainly becoming a health psychologist is a very significant way to address health and behavior, whether it's through clinical settings, through prevention at the individual or family level or community level, or pursuing research on health and behavior.
I would probably first ask the student what exactly it is they wanted to do. Are they interested in pursuing a research career? Are they interested in providing direct services to improve health? And depending on that answer, I think there are a variety of avenues one could take. I've mentored and continue to mentor a number of undergraduate students, and this is a question that commonly comes up, and I try to, if they're interested in psychology, in particular health psychology, I try to help them to realize that programs are quite competitive, that it is very helpful to have some research experience prior to applying to graduate school. It is not uncommon for the students with whom I interact to not have had a lot of undergraduate research experience. They're oftentimes students at liberal arts institutions where there aren't as many research faculty, and so these students will frequently, after they receive their undergraduate degree, go on to do some work in a lab as a research assistant for faculty members at other universities, larger universities, medical schools, and so forth. So I often will direct them towards those types of experiences. I also want them to be able to consider what other avenues there might be besides health psychology. So the undergraduate psychology majors, they always gravitate to psychology, but I think there are a lot of different directions they could go. So certainly I'm biased towards public health because I have experience and I continue to work in the field of public health. But a lot of my colleagues who do very similar work don't have psychology degrees. They have degrees in public health. I've started to develop an interest in the field of dissemination and implementation science, and there are new programs that are popping up. So if people are interested in looking at how to actually take effective interventions and help them scale up and actually be implemented on a larger scale, I think the field of implementation science is ripe for new minds who are interested in that type of work. And so that's another area where I've started to direct students.
You know, I would really want to understand what that student's particular interests are in health and behavior, because health and behavior are so broad and they can be addressed by so many different disciplines. I mean, even physicians in many ways it's important for them to understand health and behavior. And there are some primary care physicians that would focus very much on health and behavior. And we also know in the public health realm, there's a number of public health disciplines that focus on health and behavior. And then of course psychology, because when you're talking about the individual and understanding the individual's behavior and that's impact on health, then psychology is really where there's expertise in that. But I think even if that person, regardless of the route that person would go, I would think it's important that that person still develops a broad base in understanding health and behavior and all those factors that influence health and behavior. And it's not just what's happening within the individual, but it's also community level factors and family level factors and cultural factors. And so I would really, once that student decides the discipline, then I would still encouraging some broad training for that individual.
With the increasing sort of acknowledgement about the complexity of science, the complexity of health, and even the complexity of behavior, I would encourage a student to be well read, and by that I mean to read from diverse disciplines, because I see that a lot of the health psychology and a lot of the research that we cultivate in our branch, in order to be well received, it needs to actually have diverse perspectives. So I think it's important for someone not only to specialize in a particular focus, but to be open to very different disciplinary perspectives, because I think that gives you a wider lens for which to address the questions that you're interested in. And just pick a program that you really feel you fit well in, and one in which you get sort of one-on-one mentoring. You have teachers that are interested in your development, not only as an undergrad, but in your potential to go into graduate school.
Well, if they're interested in health and behavior, the behavior or psychology part of that, obviously they need to get as an undergrad to help them really get going if they're going to go into that line of graduate school. But in my mind, a factor that can be as or more important sometimes is getting the basic understanding of the health side of it, the physiology side of that, some of the biology. They don't need to be a biochemist to do this, but it is helpful if they have some training and background in those areas. I think that can take them a long way in terms of the health side. In graduate school, we can train them very solidly in the psychology side, and they'll get all of that. They have to, as part of the whole APA accreditation and so forth. But the part that they won't get necessarily from us, and could be hard for them to get, is more of an understanding of the physiological processes. So I think it's excellent if they can get some training in that before they come. Or, if they know what areas of health and behavior they're interested in, maybe they're interested in nutrition. So do some work in that. Maybe they're interested in activities, so they might want to take some exercise physiology type classes. In my mind, when I look at applications and I see some students have done that, at least taken a few classes in those areas, that really perks my interest up, because I think they then have information that we won't really provide for them in the graduate training. And so they can put those two together, and in my mind, that's a pretty solid package.
First, I'd ask them questions because when students say they're interested in health and behavior or health and psychology, I don't know what they mean. Often they're coming from my health psychology undergraduate class, and so they do have some idea, but I want to know whether they're interested potentially in research, whether they're interested in graduate education, or whether they really want to do something coming out of undergraduate study, whether they're interested in really working with people. And so, for example, they might be interested in being a nutritionist or a physical therapist. And so there are so many meanings of health and behavior that I first ask them questions. And so I want to know something about their future aspirations before I begin talking with them. And then from there I do encourage them to explore, because often they're not quite sure what they want. And so I talk to them, I tell them to do exactly what they're doing with me, ask questions. And so I can tell them about health psychology and clinical health psychology specifically, because I had my training in clinical psychology. And then I can refer them to others who are in other professions they might be interested in. And so if they're interested in health psychology specifically or clinical health, then we talk about what's needed to get where they want to go, whether they want a more applied career, a research career, a combination, and we sort of move on from there.